I'm back, y'all. Facebook, y'all do this every time, but I am so unbothered. I'm so unbothered. Um, what I find is that when I'm giving truth, they always interrupt my broadcast. And I was going to say it, I thought it, and then it happened. So, anyways, I'll see if I can get a couple of you back on here. Let's see. Just a few of you. All right, I think that's good. All right, so I think I see a few of you popping back on. But anyway, Facebook interrupted my broadcast. Always when I'm giving truth, they interrupt. And so that's what I want you guys to understand about these platforms is they are not ours. We don't own them. And so this is why it's super important to be connected with people offline as you are online. So I'll say this, and I just wrapped up with Instagram before I came back. But if you have not joined my email list, if you have not signed up for my email list, if this platform ever goes away, if this platform never tells you Nicole is live, Nicole is this, Nicole is that, and you know that I have information that is good for you, you'll miss it. So go to my website, ilovebeingfresh.com, and join the email list so that you are in the loop when I send out emails on tips, on education, on whatever. You are there. So I just wanted to recap for you guys. That's all I was getting ready to do. I was going to bring Kayla on to see so that you guys could see her face. If you were in the Charlotte, North Carolina area, you could know who she was. Actually, I see Kayla. So let me see if she wants to come on for a minute and chat. So I've already wrapped with Instagram, you guys. So Facebook is all about you. I don't know. Kayla, did you get that request? Let's see. Be coming. I just want her to speak briefly about who she is, what she does. She's a certified doula in the area. She also is a lactation specialist, but she's very educated in the area of helping mom get baby earthside, and once the baby is here, helpful with that as well. Hey, Kayla,
Hey, Nicole.
how are you? So I just wrapped up with
I'm
Instagram, but is there anything that you wanted to speak to as it related to leaving the vernix on the baby, not getting a vitamin K or Hep B shot, not getting the eye ointment, and allowing the umbilical cord to pulsate until it's done, pulse out?
um honestly, you pretty much covered everything. I would say with the umbilical cord and with all those things you mentioned, if you have a traditional OBGYN provider, it may be a little bit of a tug and pull kind of struggle because they are very set in their ways to how they believe things should be done.
Mm-hmm.
And sometimes just telling them one time at a prenatal is not, they're going to be like, oh yeah, she's did a couple Google researches, she wants to wait. And then I've seen in births where they'll wait like 10 seconds, say, okay, stop pulsating, and just cut it, or clamp it. Yeah. And the great thing about having a doula is we're like a second pair of eyes, because when they put the on you, you're not worried about anything else. You're like staring at your baby. So then after, everything died down, you're kind of like, wait, how so do we, clamp the cord? And the nurse is like, oh yeah, right after. And then, you're like, well, I wanted them to wait. And like, it's okay, everything's great. But you still didn't get what you wanted. So you kind of have to really be on your game with telling them exactly what you want, because they will try to hit you with the okie doke in the hospital. They really will. They're very set in their ways. Right.
Yeah, that's why I made the decision to go with the more holistic route and go with not naturopaths, what do you call them? Midwives, because I knew that they were more in the mindset of being in agreement with what it was that I wanted. And so I had RJ at a hospital out in Statesville, Davidson Medical, where they already know the drill. So they're, if you say you don't want the vitamin K shot, they're like, okay, she doesn't want it. Like they don't press you. They don't, Rashid was able to follow and go everywhere RJ went, and keep his eyes on him. They were even though I had to have a C-section, they were still willing to do the things in my birth plan that they could do to whatever extent that they could do it. Like, where other hospitals would be like, oh, trash her birth plan. She wanted to have a natural birth with no drugs. Well, she's having this cesarean and we
Right.
clamping it. They weren't like that. And so that's
Right.
good to know. And that's what I did is I asked my OB, who was a general practitioner, several set of questions from I can't even remember the book that I was reading at the time. And she literally answered no to every single question that I asked. And it was like things that I would want to do. Like, if I'm in pain in this position, can I turn? And she was like, no, no.
No, they
And I
will
was
not.
like,
They
I
won't let
can't,
you
I can't squat.
eat.
Yes, I
Yeah, they
thought.
won't
Well, I
let you
thought they
fly.
passed a new
It's
law.
crazy.
Did they not pass that law that allows you to eat now while you wait? I read an article last year that allows you to eat now when
As
you're.
far as I know, and I just attended a birth last month, and that was at a pretty popular hospital here, and they were still basically just pushing
I,
Jello and ice chips.
mm,
Yeah, I was
mm.
like having to sneak my client food because she was hungry.
Yeah, I mean, because you need
So,
your energy and you need your fuel to be able to push. And so,
right, yeah, and
they're
not eating that messes with your blood pressure and your
sugar.
sodium level.
It's
Yeah, your
it's
sugars, like,
counterproductive.
and so you're all,
It's very
yeah, it's crazy.
counterproductive.
So you really have to go in it, not with that, like you're gonna have to fight, but just have people around you during your birth who are going to make sure you're getting what you desire. Because many
So
of the
tell
things that women
people
are
what.
asking for nowadays are beautiful. They're not
Yeah,
hurting anything. They're just convenient for the doctors.
right, right. So are cesareans. That's a whole nother live. Can you tell people what a
Right.
doula is and why it's great to have one?
Yeah, sure. So a doula is a lot of things, but I just always like to say my job as a doula is to be whatever the mom needs me to be.
Absolutely.
So sometimes you may just need, someone there to hold your hand, but a lot of times we come in is the difference between a doula and a nurse, because a lot of people get that mixed up. Like, well, why do I need a doula? Because I have all these nurses. Well, nurses are juggling multiple patients, and when you're in labor, they may be able to stay with you for a few minutes, but then if their other patient is about to go into labor and they got to go over there and break down a room, they have to leave you.
Mm-hmm.
And say they're doing like
Right.
some kind of counter pressure and it's really helping. That is devastating for them to say, okay, I'm sorry, I have to go. And now you're just having to
Absolutely.
go at it alone. Like that was
Mm-hmm.
my own personal experience. And it was one of the reasons why I wanted to become a doula, because we give you that one-on-one attention. And like I said,
Mm-hmm.
we're whatever you need us to be. So if we need to put people out the room, we do that. If we need to sneak you
Mm-hmm.
food, we do that. If we need to help you stick up for yourself, because I don't stick up for my patients. I empower my patients to stick up for themselves. Because
Absolutely.
this is their birth, and so I want them to own their decisions in their birth. But sometimes
Right.
you just need that person to remind you. Remember, you said you didn't want this epidural. Remember, you said you didn't want them to do whatever. In the
Mm-hmm.
midst of all that comes along with birth.
Absolutely.
So, and I also like to describe it as um, like a life jacket. Like sometimes in birth, you feel like you are drowning. They're coming at you with all these decisions that you have to make, all these forms you need to make, and sometimes you just need somebody to throw you like a rope and catch you and keep you from feeling
Mm-hmm.
like you're about to drown. And that's what a
Absolutely.
doula is. We keep you afloat on a mental level, on a spiritual level, and as best we can on a physical level in terms of the intensity of the labor process. So yeah,
Absolutely.
I love doing that for women because it's something that's very priceless. Um, and every woman should have that. They should have
That
that.
support.
They should
They
have
should have that support. And sometimes dad needs a break and dad needs to step out and use the bathroom or go get
right,
him something to eat. And then mom is not left alone because you have your doula who you've built this relationship with, who has possibly gone on
right,
prenatal appointments with you and been your support that way. There's also doulas who
right.
are postnatal. So after you've had the baby, they come in, they clean, they cook. There's several varieties of
Take
that. And the
care
difference
over
between a doula
siblings.
and a
Yeah,
midwife is a midwife actually a nurse
catches the
midwife
baby.
has gone to school. She has the nursing in under her belt. She can do your exams. They can actually deliver babies. They do it all the time. So I went to I was going to birth RJ at a birthing center out in Statesville. And so if I would have opted for, if I didn't have to go to the hospital for the cesarean, if I would have opted for the birthing center, they would have delivered him there. I could have had him in the pool or in the bed. All right. So they have the ability to deliver babies, whereas doulas don't. They're at the top with mom, they're breathing with mom, they're rubbing mom's feet, whatever mom needs at the time. Do you need your music? Do you remember you said you wanted to listen to some soft, you created this playlist. Do you want to hear your playlist? Do you need me to rub your back?
Right.
That's what a doula is. She's strictly there for a mom. So Kayla, Suzanne says, how would she find someone like you in Connecticut?
There is a website. She'll have to message me. I cannot remember. I'll put the link below, but there's actually like a big kind of directory for different states
Mm-hmm.
where that like doulas can register their name.
Yep.
That's a good
Mm-hmm.
way, or asking around in a mommy group. Um,
Okay.
and just what I would say is, if you're expecting and you're trying to look for a doula that you think would kind of match your style, ask around to parents who kind of match your parenting style.
Gotcha.
Because that's kind of a good way to partner with somebody who kind of is in the ballpark of what you're looking for, because they also
Mm-hmm.
experience that with that doula, because every doula is different. Some are more
Absolutely.
homeopathic, some are more by the book, some are more nurse kind of like. So
Mm-hmm.
every doula is different. Every doula
Right.
is
Different
different.
personalities, different, all that stuff. Yep. So,
Right.
and can you speak a little bit to the lactation, being a lactation specialist, or, helping moms with
Sure.
latching after baby is born?
Right. So yeah, that is a big, big piece of what I do, and how I actually got started was in lactation. I started nursing my daughter. I was 19, and nobody in my family had breastfed, so I kind of took on that heel of doing that, and that's how I got started. But that is one of the what seemed to me like the most trying parts of motherhood in the beginning. It's
Mm-hmm.
like such a learning curve, and it's a real partnership between you and your baby. It's
Absolutely.
like that's just exactly what it's, a partnership. Your baby is learning, your baby knows how to do things, but you're also learning, but you know how to do things. So you guys kind of have to work together. And so I love just letting women know that the pressure is not all on them to figure out
Yeah.
breastfeeding. You guys are going to work together to figure
Mm-hmm.
it out, as well as not suffering if you don't have to suffer when you're learning how to nurse your baby. You don't have to know all the answers when you're pregnant, or even after you're pregnant. Find your tribe, find those people around you who have successfully nursed and have a
Mm-hmm.
good attitude towards nursing.
Ooh, a positive
Because
outlook
you don't
almost.
want to,
Yep.
you don't want to go to somebody and like, wow, I don't know, girl, it hurt and I didn't like it. Like, no, that's not the energy you want.
Absolutely
So yeah,
not.
breastfeeding is so important, and we kind of overcomplicate it in this society. But it can be very, very simple. You
Mm-hmm.
latch your baby. You keep your baby close with skin to skin. You
Mm-hmm.
you take care of yourself, and you allow other people to take care of you, and you nurse your baby.
Mm-hmm. Absolutely.
It can be it's a very simple thing, and I feel like it's meant to it can be used as self-care. Breastfeeding, once you have it
Mm-hmm.
down pat, that is your way of
Mm-hmm.
unplugging from the world, excusing
Mm-hmm.
yourself from maybe life in general. You can sit on the couch and just like gaze into your baby's eyes and like literally lose yourself, like, wow,
Mm-hmm.
I created this thing. Talk to your baby, read with your baby, meditate with your baby, latch. I used to do that all the time, and it was like such a beautiful experience to just be still with my baby as he was nursing.
Absolutely.
Um,
Mm-hmm.
so breastfeeding can be such a healing thing, and I think that's what it part of it is for. But our society has overcomplicated it and made it to where our relationships with nursing looks like suffering, and that's not
Mm.
right. So I'm excited to really try to change that narrative, especially in the Black community. Um,
Absolutely.
because it's so much suffering, and I'm like, there's so much healing you can find with breastfeeding. We just have to let go of these Western ideals that cause
Mm-hmm.
that.
Oh my God. Oh God, yes. And for me, I had an amazing breastfeeding experience. I breastfed exclusively. My son was allergic to, you know, cow's milk, anything that had dairy protein, which a lot of formulas on the market have a dairy protein in their milk. And there's one or two brands that don't have it, but they smell like poop, like literally smell
They
like
do,
poop.
yeah.
I'm like, what?
They do. It's
And they're
terrible.
expensive. And they're expensive. Like,
Yes.
give my baby this. Man, listen.
They smell terrible.
Oh my gosh. So I
Yes.
nursed
Yeah.
exclusively. I was able to pump enough, so that's where you got to drink your water, eat the right fruits so that you have enough water flowing in your body to get, more and more breast milk produced. And like I was sharing on the other live before they cut me off and interrupted the broadcast, if you can't nurse for some reason, you don't have to turn to formula. I can give you a
Right.
recipe for a natural formula that you can make in home with natural ingredients. There is also many breastfeeding banks, well, breast milk banks, I should say, that you can purchase breast milk from. There's moms who donate their milk. And so for some people that may be gross, but I mean, cow's milk is real pretty gross to me. Filled with pus. The casein is something that we can't break down because we're not baby cows. It's just a lot that goes with that. The only thing that I do remember
Yeah.
was in the beginning, it's like a breakthrough kind of experience when you're breaking in your nipples. That's the only thing that like
Yeah.
was remotely like memorable for me. But I had those cooling gel packs. There was
Right.
just things that, I used to
Yeah.
relieve, or I would skip a nursing session on this breast to kind of let it heal up a little bit before before I put him back on that one. But it was an excellent experience.
Right.
And he nursed exclusively to 11 and a half months. And I kept threatening him a little bit. I was like, you got 2 weeks, bro. You got 2 weeks and you coming up off of this. And then one day he was just like 11 and a half months and he was just like, no. And I was like, yes, shh, don't say nothing. And then like the whole day went by. I was like, he didn't ask for the boob. And then the next day I'm like, you want some boob? And he was like, no. And I was like, no. And I'm the one that was all devastated. Like, you didn't love me anymore. Oh my God. And then I thought I can go get some ice cream. Because I had to change my
Right.
diet. I couldn't eat wheat, soy, dairy. I couldn't eat anything because I was nursing him and he was allergic to all of those things because of the acidosis in his body and his gut being compromised as a result of things that I did when he was in utero that I didn't know, that I'm educating
Right.
him on now, 4 years later. So amazing, amazing stuff. When you know better, you do better. So I just wanted you guys to see Kayla's face.
Right.
If you are in
Knowledge
the,
is such power.
yes,
Knowledge is such power.
yes, applied
You don't know
knowledge.
what you don't know, but what you do know is,
Yeah,
yeah.
that's so true because you don't know what you don't like. No, I didn't know I was suffering from hyperemesis. I didn't know. I didn't know it had a name. Then,
Right.
like one day, I'm on the Facebook and people are like talking about it. I'm like, that sounds like. And then I like dig further. I'm like, oh my gosh, they didn't even tell. And I'm glad that they didn't tell me that because once I started to see the people that were in the groups and things like that, it was very negative. A lot of people talking about how they lose babies and in the 32nd week, in the 33rd week because they didn't get this nutrient or this amount of nutrition and the baby wasn't thriving. So it was very negative. So I think it was like, the divine
Right.
universe's divine way of not allowing me to see and read and know all of that. So yeah,
Right.
that was pretty much it. I wanted you guys to see Kayla's face, know that she's local to Charlotte. You're going to be seeing her do more workshops and things of that
Yeah.
nature,
It's fun.
lactations, sessions, all of that good stuff. If you need a doula, she is a wonderful doula here in the Charlotte area. So if you are having a baby, pregnant, birthing soon, here's the connection. Contact Kayla and get with her. And I'm just going to briefly recap. You get your vitamins from the food that you eat. So that's going to be your fruits, your melons, your berries and such. Do not mix watermelon, honeydew melon, and cantaloupe. Do not mix those with other fruit. They have to break down a certain way. And so allow your digestive system to do its thing. So when you're eating melons, eat only melon. So do it mono if you can. Um, Feed your body and keep your kitchen clean, which is your blood, so that your bathroom, which is your lymph system, can take everything out in the trash. A lot of the times we are compromised with our lungs expelling mucus properly. We're compromised with our kidneys not filtering properly. And so we have to get those things in order. You can up your glands during pregnancy. You can take superfoods. If you're interested in those things, I know a doctor who makes great formulas. He does good stuff. Don't get that over-the-counter stuff. I can connect you where you need to get connected. But you don't want to create these little acidosis, mucus-filled babies. We don't want to do that. We don't want to continue to pass weak genes on generation after generation after generation. The good thing is herbs will help with regeneration. So when tissue is failing, where tissue has died, herbs can bring that back to life and you can regenerate that. But it's so much easier to be on the preventative side than it is to be on the side of reversing. Easier and cheaper. So when you're pregnant, don't consume the dairy, don't consume the milk, let go of the meat, nix the toxic foods, and eat your fruits and your vegetables. That's going to provide you with the nutrients and everything that you think you're getting in a toxic little prenatal pill. You're not. So go back to the other video and part 1 and watch that video to see what it is that I said were in prenatals, the dyes, the chemicals, the chemical compounds, all of that stuff, and understand what it is you're putting in your body, you're doing to you, how you're weakening your tissue, and you're weakening and you're passing on weak genetics to your fetus, okay? So we don't want to have babies being born with compromised guts and GI tracts and, all these terrible symptoms and, weak tissues and born with asthma, eczema, and allergies. Like, we're doing that to them. We're passing those weak genetics onto them. Again, keep the vernix on. Don't allow the hospital to wash them. Let that stay on as a moisturizer and as a protective barrier. Do not let them get the vitamin K shot or the Hep B shot. The vitamin K is for clotting. They will clot on their own within 14 days. Hep B is just an acidic vaccine. They don't need it at that young age, especially for the Hep B is a sexually transmitted disease or infection. The eye ointment has petroleum in it, which you don't want to put in your baby's eyes. It clouds the vision. And there's some cases of the babies having gone blind, which is what the ointments were supposed to prevent in the first place. And allow your baby's cord to pulsate out if you can. Also, make sure you're getting in your good fats, such as avocado, coconut milk, and meat for the fatty acids for brain and nerve development. That is super, super important. Get your calcium in through plant-based methods. You can take a glandular tonic or formula. You can build your glands up. You will be passing that on to the baby, so that is a good thing. And if you're taking prenatal pills, read the ingredients, read the label, look up every single ingredient, and you determine for yourself whether that's something that you should be doing. Take back the power. Be the power. Don't pray about it. Don't ask the doctor about it. Don't ask your friend down the street about it. Take back your power. Use your intuition. Get connected back with your womb and find out what it is that you need to do for you. That's best. So that is all I have for you tonight. And green drinks. Make sure you're getting your green juices and your green smoothies in. Yes, Kayla?
I wanted to say something real quick before we got off live about the vitamin K. So if you do choose not to do the vitamin K, but you also are choosing to do any kind of circumcision, wait until the baby is at least, I would say, a month old so that they can get that clotting factor on their own.
Very great point.
I just wanted to throw that out there because they
yes.
Yeah, I just wanted to throw that out there. Wait until they're
a minimum of 2 weeks because their clotting factor kicks in about 14 days. So so anywhere from 2 weeks on, if you're going to get your baby circumcised, which is a cosmetic surgery, that's why you have to pay for it.
Yes, please. I didn't want to open up the rabbit hole.
Yeah, that's a whole nother lie. But do your research on that.
Rabbit hole. I need to throw that out there.
Yeah, that is a rabbit hole. But not get the baby circumcised at the hospital if you're not going to do the vitamin K shot, okay? Because that's for the clotting factor. If you're gonna wait, you got to wait for the circumcision as well. But look up circumcision and it being a cosmetic surgery and make that as to whether you should do that for your child or not. that's a preference, cosmetic surgery. All right. That's all I have for tonight. Thank you for tuning in. Thank you for joining me, Kayla. Thank you for part 2.
No
Facebook
problem.
didn't want us to be great, but we came back. I want to say that Fresh is sponsoring one person to go to Suzanne Stroud's Life Detox event March 24th at 12:30. Look out for an email in your email list. If you're on my email list, and look out for a post on my social medias, both Instagram and Facebook, on how you can enter to be eligible to get your ticket paid for the detox. Suzanne, put that link in the bottom, please, so that they can know exactly what your event is about, as well as go to Suzanne's page and check out a live that she did tonight on people pleasers and toxic people and yes people, and see if that's you, see if you need to detox your life. So Fresh is going to be paying for one person. We're going to be sponsoring one person to go to that event. Suzanne is also people in attendance. She's going to be putting them into a drawing to get a $20 gift certificate to Fresh. If you're local here in Charlotte, you can get $20 off of your V-Steam or V-Steam Aroma Touch as a result of participating in that event. So I hope that you do. Detox your life, detox your body, detox everything. Don't just be isolated in your detox. Let it all go, whatever doesn't serve you. So thank you so much for tuning in. Again, I didn't say who I was at the beginning of the video because Facebook wouldn't let me be great, but I am Nicole Brantley, and the name of my company is Fresh. It stands for Feminine Restoration Education and Solutions for Women's Health. I help women reverse fibroids, PCOS, endometriosis, conceive. If you're having trouble with conceiving, I help women with their fertility issues, an array of things. If you're dealing with chronic yeast infections, chronic bacterial infections, this is what you need. You need to get you some adrenal tonics, and you need to get you some kidney and bladder tonics. You got to get your kidneys filtering if you're having chronic issues with that. So thank you for tuning in. And I will see you guys on the next Wednesday, Womb Wednesdays, late night chat with the womb therapist. And in the meantime, you can follow me on Instagram at womb therapist, or you can go to my website, ilovebeingfresh.com, and you can have access to see everything that I do, as well as have links to all of my social media. Thank you for tuning in and joining us tonight. We'll see you next time. Bye.